Welcome to This Week in Health IT events, where we amplify great ideas with interviews from the floor. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. We want to thank our founding channel sponsors who make this content possible, Health Lyrics and VMware. If you want to be a part of our mission to develop health leaders, go to thisweekhealth.com/sponsor for more information. This episode is sponsored by Health Lyrics. When I became a CIO, I was really overwhelmed at first, and one of the first things I did was to sign a CIO coach to walk with me through the journey. This was someone who had wisdom that can only be gained through years of experience. It was invaluable to my success in the role, and I now coach CIOs through Health Lyrics. If you want to learn more, visit healthlyrics.com or drop me a note at bill@thisweekinhealthit.com. Over the next 3 weeks, we have a huge treat for you. I'm really excited about it. I just got back from the CHIME Fall Forum in Scottsdale, which was a great event, and we caught up with 12 active CIOs from various size health systems and asked them to take a look back at 2019 and a look forward at 2020. You're going to hear what they're excited to have accomplished last year and what they're looking forward to accomplish next year. I asked each of them the same 8 questions, and I think you're going to be fascinated to hear the similarities and the differences based on where they're at, geography, and other things. Each of these interviews is about 10 minutes long, so you can listen to them really quick, and some of you listen at 1.5 times speed, so it's going to go like that. We're going to publish one a day with a few Newsday episodes sprinkled in through the end of November, so check back every day for the next episode, and don't forget to look back to see if you missed any. Our next guest is a returning guest, Joel Venko. I caught up with Joel last year at the CHIME, this year, CHIME Spring Forum at the HIMSS conference, and I got a chance to sit down with him again at the CHIME Fall Forum, and we have a really fun conversation. We actually ended up talking for about a half hour. You're only going to hear about 15 minutes of it, but really appreciate his perspective. Joel is the CIO for Baystate Health. Hope you enjoy. So Joel Venko, Baystate Health in Massachusetts, as you educated me on the last time you were on the show.
Good to see you again, Bill.
It's good to, I appreciate you sitting down with me. This is great.
Sure.
And you know what I'm excited about is we now have 10 CIOs on the record, including you, answering the same 8 questions. So people will get an idea of how different size health systems and different markets are thinking about things. Because the challenges, there's a core set of challenges that are the same across healthcare.
Yeah.
And then there's geographic challenges. We just had somebody on all rural hospitals. And I said, what's the most challenging thing? It was like our network. And you think about that, you're like, oh yeah, that would make sense to me. I mean, you're in this town and this town. You're not in Dallas and Houston. You're in, who's calling me?
Oh. You have more important things to do.
No, this is the most important thing I have going on. So I really appreciate you being here. So the first question is not necessarily how has the role of the CIO changed in the last 5 years, but how has it changed over the last year? How have you felt sort of a change in the expectations of the role of the CIO in 2019?
Well, I think it's continuously becoming more of a strategic role. There was a point in the last 5 to 7 years where folks were even questioning whether the CIO role was going to exist, right? Is it going to be the CDO? Is it going to be the Chief Transformation Officer? Now, those roles absolutely exist, but I think the CIO role is really transforming into become a senior leadership role focused on strategy, really focused on the business with expertise in technology, and that's really where I've seen my role evolve over time, as I've even elevated to the president's cabinet, which is what we call our sort of senior leadership team under the CEO, and a lot of the discussions there are about what's the strategy for Baystate Health look like, how do we support that, and by the way, what's the technology that has to support that business objective or those strategies.
So that's what they're looking for you to say, to look at the strategy and then look at the technology landscape and things that are going on in your market and understand that and sort of apply technology to those
Absolutely.
problems.
Yeah, so there's an expectation, at least in my team, and I appreciate that expectation, that that I should know the business. Now, I don't have any clinical background. I did go to medical school for a couple of years before I dropped out, but that's a different story. We can do a different interview for that one. But and my parents did forgive me after I dropped out, now that they didn't know what I actually do. But I think as a CIO in today's environment, if you don't understand the business, you don't understand the folks that utilize the technology, you're going to be in a really deep, dark hole, and you're going to be isolated, and they're just going to treat you like what I think they treated CIOs and technologists in the past, which is sort of the basement, lights on, keep the lights on kind of team.
Make sure my iPhone works, make sure my laptop works.
I mean, there's still some of that, right? Well, but you got to get yourself out of that.
That's the core of the job.
Yeah.
I'm glad you're talking about business and business strategy. So what are some of the business strategies, maybe three, I have here, 3 priorities for your health system next year that Health IT is expected or is going to support?
The elevation of the consumer into really every strategic plan is a big thing. So there's a focus on the consumer or our community, really. I mean, it's always been about the patient, but now there's this notion about how do you really engage with them using various vehicles and channels, including digital. So consumer is a big deal, and really just rebuilding our health system with the consumer in mind rather than with the provider in mind. That's sort of the first big strategy that we have for the next 3 years, really. Population health continues to be, a big deal for us. Value-based care and population health are kind of bundled for us, and we've been in that game, as I spoke to you about last time, for quite some time, and we continue to increase our risk pool. We're close to 50% of our population now, and we're going to continue to grow that. And I think the third is really our workforce. Our CEO is really focused on making sure that our workforce is not only engaged, but they understand with clarity where we're going, and they feel like they're part of the mission, and we're giving them the tools that they need and the training that they need to really effectuate transformation in the health system.
So let's drill down on this a little bit. So if I were a patient in your community, what's one thing that you're doing that's going to materially impact how I experience care within your community?
Well, access for us is a big issue, one that we've been attempting to tackle for quite some time, and really now it's really the core, probably the first core pillar of or the first core step of our consumerism journey is to really figure out how to address this access issue. And so for the consumer, we're really trying to figure out how to put them, give them the right care, put them in the right environment, give them the right access to our health system. And again, that comes in a variety of different channels and different means. But we have to know our patients first to be able to say, hey, Bill, we know you're fairly healthy, and we know you're just sort of post-surge and probably afraid of that big wound that you have on your chest, but you really don't have to go see your cardiologist. You can go to XYZ channel to engage with us. So we're trying to figure out
that's a lot more than telehealth. There's some telehealth there. There's some. Are you looking at chatbots and those kind of things? Or?
We have started to look at chatbots. We haven't really done much in terms of piloting yet, but we're considering, how that can help our contact center triage some of those calls appropriately. We've been using some apps also that we discharge patients with that help them with their care plans, they're managing their pain, giving them the access to care managers and even physician extenders as they need them post-surgery. So we're starting to use a lot of these different tools to really sort of manage care post-surge outside of the house, hospital, et cetera.
So how about one initiative that's going to, same kind of question, materially impact the clinician experience?
It's really well, we're optimizing, continuously optimizing our EHR, and so I'd say that that's probably our biggest and perpetual, piece of work is to continue to optimize the EHR, and some of that is in the native EHR, and then other initiatives that we've taken on are actually sitting on top of the EHR, like an app that we actually helped develop in TechSpring. It's called Praxify, and actually it's now owned by Athena Health, but we're a Cerner shop, and Athena has this app that actually sits on top of Cerner that enables hospitalists, for example, to round on patients very seamlessly using their iPhone, and they can see documentation. They can actually document. We're about to execute on a function where they can actually do orders through that app. But things of that nature where we're giving folks the ability to choose. And I think that's an important part of our optimization work is we're hoping to get to the place where we're giving clinicians choice on how they interact with our EHR.
So that's one of your wins from your innovation?
Yes, absolutely. When you have clinicians saying to you, Bill had this app, how come I didn't get it? That's a win, especially when it's a technology that you deploy. Adoption is a big issue with technology, as you know, and if clinicians are asking for it, that's a good thing. When it goes viral, it's a good thing.
What's the name of your innovation arm again?
So it's called TechSpring.
TechSpring, thank you. Because you mentioned it there again, and we talked about it. I think you're assuming that the audience is going to know this, but we have a lot more listeners now than we had back when we talked at him. So,
TechSpring is our innovation. It's basically our innovation center at Baystate Health, but I'd say it's a very unique model in that really the focus of it is to identify what we call passionate problems in the healthcare system and match them up with folks who can actually deliver transformative solutions to those problems. And a lot of them, either come by way of a vendor partner that we have, somebody that's outside of the industry who thinks they have a great idea, startups, etc. So they come and meet us at TechSpring and they connect with these business leaders across the enterprise to solve some of the biggest problems.
So what's, as you look at 2019, what's one of the things that you're most proud of your health IT team for having accomplished?
I think that our focus on continuously improving our clinician experience is something that is, again, it's a journey, but this past year has been, I think, a profound move forward, not just with the technology itself, but getting clinicians more involved and deeply involved in the technology so that they can make change. It's not enough to just complain about the unusable components of the EHR, but to be a part of that is a big deal. And I think my team has done a great job at really involving them, but also being out there. They round weekly on every unit. We have business relationship partners, or business relationship managers, as most call them, for every division in the health system, and that's created a really deep connection with our.
That's a neat model. There's part of me that wants to go deep into that and ask you questions around, how you finance that and what other roles those people are doing. And
I think that's a great conversation to have, because we were challenged by that that very question: how do you finance that? But I can share with you guys how we sort of did it, and it was really sort of a very innovative approach.
Well, we will definitely do a full episode with you, not the abbreviated. This is the second abbreviated one we've done. We've got to schedule the other one. I've been phrasing this question as, what's your biggest missed opportunity for 2019? And I've gotten some feedback now that it's not the best way of asking that question.
Oh, so not PC enough?
Well, no, I think how I want to ask the question to get to an answer is, we're busy. CIO job is a busy job. A lot of priorities, a lot of things people want you to tackle. What's one thing you wish you had given more time to in 2019 that you just couldn't get around to because of all the competing priorities?
Oh, that's a great question. A loaded one, but it's a great question. I think that I'd say probably the one area that I think really needs a lot of focus, at least in our organization, is our consumer platform. So back to the consumerism piece. We're really just, I'd say, optimizing our patient portal. And so we really focused on really creating an experience of what I'll call a traditional portal. to the level that I think it needs to be at this point. But we really didn't create a broader strategy, or we didn't really execute on a broader strategy of really beginning to engage patients the way that I would have liked to. But it also starts with what I'd say is a larger coalition of partners across the enterprise. And so I guess maybe that's the big sort of regret for the year is that because of all the things that we were doing, bringing on a new a new hospital, going live with Workday, all the stuff that we do.
So you were just sitting around on your hands all year?
All year, I was just sitting like this, But not bringing folks to the table and say, hey, let's talk about the consumer strategy, and therefore let's talk about the digital strategy. So we're going to do that this year. We're really going to focus on bringing folks from a variety of disciplines to talk about that strategy.
Workday, new hospital.
Yeah. Workday, new hospital, teletracking. I mean, you name it. It's it's the everyday CIO, right?
What's an area you'd like to see more innovation that within healthcare that you'd like to see the industry really move the needle?
At some level, it's not an innovation. It's sort of back to sort of blocking and tackling, or actually plumbing. I'd really like the industry to really focus on data, data management. Making sure that the data is liquid and liberated. I think we're getting there with with things like FHIR and all the API work that folks are doing. But there's also that one sort of area that's still kind of not sexy, which is you got to manage your data so that it can be usable. When we talk about AI, we talk about ML, all these great buzzwords. You can't do any of that stuff if your data is not good, right? So, maybe it's not innovation, but maybe there's an innovation that can help us really manage that data better and get us to a place where we can really leverage that information. Because at the end of the day, when we look at all the things that are on the horizon that we want to achieve in healthcare, which is to transform it so we know who you are and give you the proper care, it boils down to, do we have information about you enough so that we can do what Amazon is going to be doing, which is, not only are they going to start to, sell you stuff, but they're going to say, you know what, because you bought that stuff and because you're, in this region and because you're XYZ, this is what you need in your healthcare today. And we're not quite there yet.
I was talking to a healthcare CEO and they were saying, and actually we were talking about an article, and they were saying how, what you eat dictates an awful lot of your health, right? And there was this study, and if I remember the study, it was in London, and they could, by zip code, based on grocery data, almost predict the health of the population in that community. When you think about Amazon and their push now, same-day delivery, Amazon Fresh, free for Prime members. This is not an advertisement for Amazon,
right?
But it's
a great example of that. Yeah.
But it's interesting to see now that and Cerner is an AWS platform, so you have your Cerner data, you have your patient data in there.
Yes.
You could potentially have a significant amount of grocery data in there. There's some interesting things that start to evolve in terms of really getting a clear picture of the whole patient.
Absolutely.
We're eking into a full episode here, so let me finish that. We did a survey of our listeners, and one of the things they want me to start asking CIOs is, what roles do you intend to hire in 2020? Do you think there's going to be growth and need?
So, one of the areas that I'm really focusing on right now is in this area of design. Design thinking, human-centered design. It's really an area that I think technology, IT really needs, because it's no longer just about, plugging things in or deploying things, right? There are considerations of workflow and considerations of use. I don't want to use the word delight, but folks use delight oftentimes in terms of how does this really impact a provider or a user. Folks who understand how to create journey maps of both the patient and users of our technology, but ultimately it's designing either a workflow or even an app that requires a different type of sentiment and different kind of skill set that I think IT organizations just don't have. And there are some organizations out there that have some really great examples of design studios, design teams, and I think that's one of the areas that I think it would help us, not just with the consumerism strategy, but also with the workforce piece and making sure that we're doing right by our partners.
It's interesting. So the big winner in these, by the way, these questions has been the arts. Because now people have said data science and those kind of things because we have a lot of data. We need to do stuff with it.
That was going to be my second one, actually.
But an awful lot about creativity. It's like, okay, how are people using this technology? How can we make it more usable for these people? How can we for our users? And it's really the coming together of your left brain and your right brain.
Yeah. Well, I think that's going to be really. I think those are going to be the careers of the future. When you think about where technology is going, AI. I mean, the stuff that we're coding right now, which is mostly now drag and drop and fairly rudimentary, not rudimentary, but they're very nice coding segments. Not like when we were starting to code, but that's going to become a commodity kind of an activity, and really the winners of I think industries are going to be folks who can create stuff out of nothing. It's design, it's the, let's build this and make it look like this, and then sort of just, give it to the machines to really sort of build. And I tell that to my kids all the time they love math, they love technology. And I say, what's even better is the stuff that you guys do, in writing and drawing and the creative side is really what is going to be the profession of the future in many ways, the liberal arts, if you will.
It's interesting. Yeah. Joel, always a pleasure.
My
we
pleasure,
will have to schedule a full episode after hymns, probably.
Great.
So
I'll look forward to that.
Thank you, sir.
Okay.
I hope you enjoyed the conversation. Remember to check back often, as we are going to drop an episode a day for most of November of 2019. Following that, please come back every Friday for more great interviews with influencers, and don't forget, every Tuesday we take a look at the news which impacts health IT. If you want to support the fastest growing podcast in the health IT space, here's a few ways that you can do that. The first, share it with a peer, share it with a friend, share it with somebody who's working right there next to you. Number two, sign up for Insights and Staff Meeting. These are services designed to help you in your career. Number three, interact with our social media content on Twitter and LinkedIn. Number four, post or repost our content. And number five, always send me feedback, bill@thisweekinhealthit.com. Your insights continue to shape the channel. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or our YouTube channel. Special thanks to our sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Thanks for listening. That's all for now.